We begin this noontime, though, with a picture of progress as it relates to the distribution of the COVID vaccine here in Rhode Island. Good afternoon, everyone. I'm Erica Ritchie. As of yesterday, we're told just under 12,000 people in Rhode Island have gotten inoculated so far. That's according to the Department of Health, who is expected to bring us an update just over an hour from now. 12 News reporter Brendan TRUITT joining us now live in Providence with why today's briefing is particularly timely. Hi, Brandon.
Hey, Erica, you know, the state started vaccinating people just over 2 weeks ago, and so far, just about 1% of the state has received their first dose. So today's update is coming at a time when some are questioning whether more can be done to speed up that process. Since the first shot was given out, Rhode Island has been rolling in vaccines against COVID-19.
Guys, this is almost over. We're like in the last lap of the race, and we're so close.
And it has been described as a race. There is growing concern that Operation Warp Speed is not living up to its name.
There's no doubt about it that things are going a little bit more slowly than we want.
Dr. Ashish Jha with Brown University School of Public Health slamming the nationwide rollout from the federal government.
I think we need to really ramp up the vaccination, get the vaccines out to states, but then also get the vaccines from the states into people's arms. It's going more slowly than I think any of us would like.
In Rhode Island, vaccination started this week in nursing homes and other congregate care facilities. CVS taking doses to each location, delivering and administering it to the people inside. First responders also getting their chance at a shot. The ACI also vaccinating employees and inmates there too.
My hope is that the vaccines that we have right now probably are going to end up being effective. We have no reason to think they're not.
Doctors have warned the vaccine is only as effective as the number of people who get it, with public health and a return to normalcy hanging in the balance. So it's unclear how or if Rhode Island has been directly impacted by distribution delays. That is something I plan on asking the Department of Health later this afternoon. I hope to have an answer for you when I join you next at 4 o'clock. Live in Providence, Brendan TRUITT, 12 News.